Most of the time, it's going to decrease someone's sperm count. It doesn't necessarily mean that it's going to decrease motility or morphology of the sperm. Everybody's going to be different. Things that affect motility, which is the activity or swimming of the actual sperm cells, because obviously if they're not swimming, then you're not going to get any pregnant. And then the morphology is the shape of the head and tail, make sure they're not deformed, it can penetrate the egg and so forth. So someone's diet itself is going to reflect more on that. The more healthy they eat, the antioxidants and things like that are going to improve the morphology as well as motility. It only takes one. So it's a numbers game. That's why they use total sperm count as a determining factor. But like I said, you can literally have one viable sperm cell makes its way and then boom, you're pregnant. But a lot of times that it will decrease someone's sperm counts to usually I see low normal levels.
Yes, because when you take TRT, your brain senses that testosterone coming in, so it shuts down the releasing hormones that keep your testicles moving. So you can't target just testosterone or semen production or fertility. So when the testicles are shutting down, they're shutting down on both. When somebody uses testosterone, the testicles will shut down. Some people will fully go into atrophy. I would say about over 70% of the men need some type of assistance like HCG to support the testicles. There are men who are on testosterone, they're not on HCG, and they have achieved pregnancy. It's not common, it's very, very uncommon, but possible. Most men, I tell, if you want to preserve fertility and you want to have children down the line to be safe, you would want to use HCG along with your testosterone treatment to support the testicles from completely shutting down. Most men can achieve pregnancy between 1 and 4 months by doing these sort of techniques, but everybody's different.
TRT can affect fertility. Everybody's a little different on that one too. If you're planning on having kids in the future, I highly recommend using HCG. I've seen people online post that their woman's planning on getting pregnant. They're going to hop on HCG. They've been off it for 4 or 5 years. She may get pregnant. She may not. She may get pregnant. He might not be the father. So if you're planning on it, I would use HCG out the get-go until you're 100% sure you don't want kids.